I don't know if, in the zoo world, but in South Africa, I mean, for a very long period of time, we only used to do most of our captures in winter. There was a lot of discussion about what time of the day you were going to do captures. If it gets too hot, then everything gets cancelled. Anything above 25 degrees Celsius, they become very, very nervous. And for a long time, it was thought that the problems that are associated with hyperthermia or high body temperatures were really down to the environmental temperature. Leith Meyer, a colleague of mine at the university, had shown through his own PhD that the body temperature has got very little to do with the environmental temperature, and it's almost entirely the stress-induced hypothermia that these animals are experiencing. Even if you chase animals, the actual physical exercise only pushes their body temperature up a very small amount compared to what can occur when they've experienced stress. In rats, we know from lab animal studies that you can actually, body temperature is a very accurate way of determining overall stress levels, actually more accurate than measuring their cortisol levels. So very quickly, when there's acute stress, you can push their body temperature up. And in cheetahs, we've seen it go up to 43 degrees Celsius. And so that's going to cause quite a serious problem. And having darted quite a number of cheetahs at Africa, these are semi-captive animals, but they still had to be darted, and under various different conditions, we built up quite a experience of understanding exactly what happens there. So this is Leith's work. So I'm looking at impala, and he basically said the cause predominantly by stress rather than the effects of physical activity that occur before the recumbency, environmental conditions, or the effects of immobilization drugs themselves. Right, responsible for the very high body temperature. Yeah, so we'd been for several years working at AfriCat and darting the animals. What is interesting, we started developing this, what we call a stress score on the animals. So a score of 1 is basically where the animal is sitting or lying down, calm, there's no growling. A score of 2, they're sitting or lying with occasional growling at you. 3, if they're walking or pacing with occasional growling. And then 4, when they're basically running backwards and forwards, trying to escape in the actual camp in which you dart them. And there we'd often get the cats into a small area so that they're within range, to be able to be darted. But that getting them into that enclosure, they immediately kind of have, and they see you come up with a dart gun, they start getting quite anxious. And certain individuals just go absolutely mad. And what we were able to, over many anesthetics, notice is that the stress level was definitely correlated with the body temperature in these animals. So animals with a stress score of 4 definitely had a body temperature immediately after immobilization of over 40 degrees Celsius. This was just a very interesting study, also done by one of Leith's students, where they implanted cheetahs at AfriCat with these temperature loggers. They also were able to measure acceleration. So they could, the whole question here was whether or not cheetahs abandon the hunt because of overheating. So that was I mentioned this theory before, that they stop running, that they can only run for short distance because their body temperature goes up too high. Well, that was the theory. So they tested this theory and got some really very interesting results. And I'd like to show you here. So first of all, they looked at whether or not the animals were successful during a hunt. So cheetahs will chase an animal, and if you think of the physical activity of a successful versus an unsuccessful hunt, they should be, the same amount of exercise or physical exertion. But what they found was there was quite a big difference between unsuccessful hunts. So there you can see where the hunts are, and you can see the body temperature is the dark line. All right, where it didn't go up very, very high at all. But then we noticed that successful hunts, in other words, where they then had the prey at hand, the body temperature just shot up, okay? And it shot up quite early on, okay, after the hunt, or after the actual hunt took place, the body temperature would go up. So this was quite interesting. Same amount of physical exertion, but then actually whether or not they had meat to eat or not suddenly determined the body temperature. Then the other interesting observation was there were 2 cheetahs in a male coalition One was an animal that wasn't lame, and it actually participated in the hunt. It hunted the animal itself. The other one was lame, and all it basically did was walk up to the carcass after the other cheetah had hunted it and shared on the carcass. And what was really fascinating to find was that both the animal that chased and killed the animal, the prey species, as well as the animal that walked up to the actual carcass and ate, both developed a temperature spike. The authors of this paper then concluded that the reason for the temperature spike was that these cheetahs now had a carcass which they were very worried about was going to get stolen, or they had to be vigilant about, some hyenas or leopards coming to steal the carcass away from them. I disagree with that. I think these cheetahs get very excited about having food available for them. And that the difference between stress, acute stress, and excitement is very difficult to tease out. But it does show very clearly that sort of, effect has got nothing to do with the actual energy that they exert during hunting. Okay, their temperature does go up slightly during hunting, but it's nowhere near that sort of excitement or stress-induced hyperthermia that you can actually get. All right. So we know it's mainly a stress response. The time during which stress remains very, very high. There's minimal environmental effect. I mean, I've anesthetized in animals in Namibia at 35 degrees during the middle of the day. And if they are calm and really, relaxed during the immobilization themselves, their body temperature is absolutely normal. They're not, suffering from hypothermia. One of the problems is the alpha-2 agonists, like metatomidine. We use metatomidine in all of our combinations. Most carnivores we use metatomidine. It causes severe peripheral vasoconstriction, so there's very little actual temperature loss through the actual skin itself. A lot of that heat remains in the core of the animal, and that is a potential problem. The temperature can go as high as 43. But generally, we can manage them now, even if they're very, very high. And I probably would even take a risk with a cheetah that's got a temperature of 43. I'll still be able to manage it and keep it alive. Usually not too much of a problem, but I'll tell you more about that in a moment. So this was just interesting. I mean, and at Africat, we have a leaf blower and iced water. And these animals even had their abdomens clipped for ultrasound examinations that we were doing part of a research project. And we would start cooling them down, with this blower, and you can just see. I mean, after 50 minutes or an hour, we really actually have made very little difference at all. And I mean, you can put your hand on that skin; it's ice cold with a leaf blower, and yet the animals are not cooling down internally. And that's mainly because, as I said, that the drug that we're using, the metatomidine, causes the vasoconstriction, so you don't get blood flow to the skin, very much blood flow to the skin, and you just don't get the cooling. So that presented a bit of a challenge. All right, so the purple arrow over there is when we started them on an inhalation anesthetic called isoflurane. And isoflurane we know is a vasodilator. So we quickly realized that one of the ways to cool them down was to try and get them on the gas anesthetic as quickly as possible. We get vasodilation and bang, the temperature starts coming down. And we actually found that you need to, when you get them to 40 degrees Celsius, we actually start putting the blankets on, stop any cooling, because otherwise they end up going too low at the end of the anesthetic. And then, they shiver when they're waking up. So we kind of got a good feel of how quickly we need to just slow down and stop the actual cooling. And this was just a whole bunch of cheetahs that were quite stressed during darting, and shows the same sort of pattern in most of them as to, when we actually started with the isoflurane, intubated them, started them on gas, and you can see the temperatures coming down quite quickly after that. This was a particularly bad one, a cheetah called Raisin, that was immobilized, and then had a temperature of 43, but we managed to get it all the way back down again without any problem. Propofol is another anesthetic that we were testing out as part of a drug combination or anesthetic protocol that one of my PhD students was working on, and we actually found that there was very little change. Actually, propofol, interestingly, in dogs and cats we use it because it's very short acting. In the cheetah, it's not a good idea. Okay, it keeps them asleep for a long period of time. Surprisingly, they metabolize it very, very slowly. But the interesting thing here is to show that it didn't cause the same vasodilation that the isoflurane did, and so the cooling using, on propofol was much, much slower. So just in terms of human hyperthermia itself, I mean, it's got a fairly high mortality rate if it's extended over a longer periods of time. And I mean, you get central nervous system issues with seizures, heart failure, with tachycardia and pulmonary hypertension, myocardial failure, and then DIC, which is disseminated intravascular coagulation, or as we like to often refer to it in veterinary fields as death is coming. Because it's once you get that, you get massive coagulation in the lungs, and it's very difficult to then actually treat those cases. Just what was very interesting about these were blood gases that we ran on the cheetahs, was that most of these hypothermic cheetahs had a very low carbon dioxide level in the blood. Now the reason for that is because they are hyperventilating. So cheetahs don't have sweat glands, they can't get rid of the excess heat. The only way that they can get rid of the heat is by panting. So they pant a lot, and that pant, they lose a lot of carbon dioxide from that. Now, if you know of humans that have a panic attack, all right, and they start hyperventilating because they're panicking, they often can pass out. And the reason that they pass out is because the CO2 levels in their blood go very, very low, and that causes vasoconstriction to the blood vessels, the carotid arteries that go to the actual brain. So they have reduced blood flow to the brain. And then they pass out. And obviously when they pass out, then they're no longer anxious whilst they're unconscious. So the body kind of resets itself, and they go back to normal again. They start breathing normally, and their CO2 levels go up, and they then wake up again. Now, one way in which they prevent them from passing out is they make you breathe into a paper bag. Okay, and the reason why you're breathing into a paper bag when you're anxious is to try and increase your carbon dioxide levels, because that causes vasodilation to the actual brain and it keeps the blood flowing to your brain. Now, so the big question was, what is actually going on in these cheetahs if they are hyperventilating and have a very low CO2 level? Now, the interesting thing is that in studies in dogs, and I'll just read this because you might not be able to see, and humans, we've demonstrated that hypocapnia, which is a low carbon dioxide, has the opposite effects to hypercapnia. That is, that the coronary vasoconstriction and a decrease in coronary blood flow accompanied by an increase in oxygen extraction. So what that basically means is that it's not just the blood vessels that go to the brain that you get this vasoconstriction, but you also get the blood vessels that go to the heart are vasoconstricting at the same time. So you've got reduced blood flow to the heart when you have a very low CO2 level in the blood. So this creates a real kind of problem for these cheetahs. First of all, they are really, really stressed. So you've got a lot of adrenaline running around the system, making that heart work very, very hard. Anyone who's had a bit of an adrenaline rush will know that your heart is thumping in your chest. All right, it's working very hard to try and push blood to your muscles because it's, in fight or flight mode. You really want to be able to run very fast and go somewhere. The problem is that you've already been anesthetized now, so you've already very, very low oxygen. I mentioned that most of these drug combinations, you're going to sit with a oxygen concentration of around 60 millimeters of mercury rather than closer to 100, which is what it should be. The second problem is that we also know from other studies that the effects of hypothermia, for every 1 degree that your body temperature goes up, your oxygen consumption goes up by 10%. So if you have a cheetah that was normally at 38 degrees Celsius, now you put it at 43, that's 5 degrees. It's using 50% more oxygen already, okay, than it would have been if it was at normal temperature. And then you hit them again by reducing the blood flow to the actual heart because of the low CO2 levels. Now you've got 4 effects directly on the heart. And what these cheetahs die from, okay, is acute heart failure. You're pushing that heart so hard without any oxygen in a system where eventually it's going to start failing, and you're going to get a fatal arrhythmia from happening because the heart cannot keep performing at that high level without support. So what we've So this was just to show you that on many of the post-mortems, the what we find on post-mortem is diffuse congestion and interstitial edema of the lungs and flooding of the alveoli with eosinophilic fluid. And that is typically what we would see. I mean, you don't see very much because they die so quickly, okay, but massive congestion of the lungs, acute heart failure because the heart has not been able to function, it eventually has failed as a pump. And then eventually they can actually develop a problem in the muscle, so you can get a myoglobin urea, what looks like capture myopathy in them. But the primary lesion is not in the muscles themselves, it's in the heart. So the heart is really failing. What we found though is, I mean, this is now, for example, okay, yeah, you got another blood gas analysis here. The PCO2, I mean, after putting them on isoflurane and oxygen is pushed up to 54. Okay, and yeah, you would see that the, where's the oxygen concentration? Yeah, it's at 372 millimeters. So when you put them on oxygen, intubate them, put them on oxygen, the oxygen levels go right through the roof. Okay, and the CO2 levels go up as well, right? So really for translocations, you know, we try and keep the stress obviously to a minimum, but there are certain situations where that's absolutely impossible to do. I mean, you just got stressed cats and you have to move them, okay? We always say that these vets should be prepared to cancel the procedure and come back another day, but very, very important. I mean, by far the most important thing that I can recommend most of these people is that they have oxygen available. I always tell my students that it's the most important emergency drug. Forget about the adrenaline. If you have to give adrenaline into a heart of an animal, it's already too late. I mean, they're probably going to die. So we always carry oxygen around. We're always willing to intubate the animals. I never leave them just lying there without an ET tube in. So we put them, the ET tube in, and then we'll actually ventilate them, especially if the temperature is very high. I now don't worry too much. If the temperature is sitting at 41, 42, 43 even, I'm not worried about getting that temperature down back to normal. I just want to keep that cheetah completely anesthetized and make sure it gets enough oxygen. And then I'll gradually get its temperature down over time. What we certainly don't see is temperature damage to any of the organs in the body. The temperature at a high level like that, the body can tolerate a high temperature for short periods of time. And short periods of time means a few hours. If it goes on longer than that, then you may actually see some temperature damage. The most sensitive organs in the body for temperature are the gut and the brain. We certainly don't see any brain damage in these animals. We certainly don't see any diarrhea or problems related to sloughing or damage to the intestine post hyperthermia. So the temperature itself is causing a problem in terms of these animals hyperventilating and then ending up with low CO2s, reduced blood flow to the heart, etc., etc. But the main treatment for the problem is to try and make sure that they're properly oxygenated and that you keep them asleep for as long as possible till you've got that heart nice and stable and functioning well on a very high oxygen level. We do cool them down with cold water, or I mean, even if water is available, we found Leith found in one of his studies that the best way to cool animals down is not to use, I mean, you can use ice packs if you wanted to, but the best way by far to cool a stressed, anesthetized animal down is to just use lots of water. Even if it's at room temperature, just pour the water on, allow the water to run off the animal onto the ground. It transfers the heat from the surface of the body away from the actual animal, and that's far more effective than any ice packs or anything else. Certainly the leaf blower with the combined water running off the animal is a very effective way to cool them as well. Then we basically try and put them in a very well ventilated crates. Those crates can become like an oven, especially if you've got very high humidity and you're transporting them in the crates. You don't want to make them any hotter than they already are, and you want to make sure that there's good airflow. And then really the thing that has revolutionized this for us, again, I said, are these tranquilizers and using tranquilizers in cheetahs. We tried a few different ones, but by far the best one in cheetahs that I've used so far is just the water-based perfenazine. As I said, I'm not even sure it's available in Australia, so it's not available in South Africa. I mean, in South Africa we get lots of different drugs, and we can have them compounded and so on. So that is something. But then you might not need them for your fairly placid zoo cheetahs. Other ones that we have used is Zuclopentixel as well, which has been tested, but then you would go very much lower. This one study where they looked at sedation with perfenazine enthionate or enanthate, which is the oil-based one. It worked perfectly fine, but we use it at 10 times lower dose with the water-based one. They found quite a few problems of side effects with zuclopenthixil when they used it at, I think, 0.6 milligrams per kilogram, and I would go all the way down to 0.1 milligram per kilogram if you're going to use it, because they stopped eating. It affected appetite, and we had animals falling over. And whereas with the perfenazine, when they wake up after we've released them, they walk out of the box and they're absolutely fine. Really, no long-term side effects. They sleep in the box, but if you try and open the crate, they will wake up and lift their heads. So they're not anesthetized; they are just sleeping, and that's kind of the best way to transport them. We even had one transporting quite recently. We were taking cheetahs, or I wasn't taking them, but Vincent was transporting them from Tswalu, from one of the reserves, to the holding bomas, and he had 3 of them in a crate on a trailer, and the whole axle on the trailer came off. So these animals went flying off the back of the trailer. Fortunately, when you found them, they were very chilled in their crates, lying on their sides, the crates lying on their sides all over the road. But the animals were uninjured and absolutely calm in the actual crates. So just loaded them back onto the back of the truck, and fortunately they were very close to the actual boma, so they could move them fairly easily. So, and then moving them now to India, where the transit is almost 24 hours. And some of that, the last part of that trip was I'll show you in a military helicopter, where the sound goes up to 85 decibels, just because they're not well insulated in terms of sound, those helicopters. And the cheetahs do get a little bit anxious. You can see their respiratory rates go up, but we sort of had no problems. And India is incredibly hot, so despite that, we had no mortalities in the last translocation. So things are getting a lot better with regards to that, and I think we're figuring it out and doing fairly well now.